Hey girl, today on the podcast, I have a special treat for you. So make sure you stay tuned and listen through the whole episode because I have an interview with an amazing and local sex therapist. Miss Cat Fite is on the show today, and I am so excited for you to hear our chat. We talk about so many different things. Our fields overlap so much and we could go on so many different tangents, and I have to say we did a pretty good job of reining it in, and I am excited because I know that she is going to be on the podcast in the future and we are going to be doing some awesome things together. But today we are going to be chatting with Miss Cat. Hey, I'm your host, Dr. Desiree Cassell. I'm an orthopedic and pelvic floor physical therapist specializing in women's health, aka pelvic floor. I'm a wife, mom of 3, foodie, lover of all things movement and nature, and I'm super passionate about educating, empowering, and supporting other women like you to find and maintain balance throughout all aspects of their lives, without pain, pressure, or peeing their pants. And this is the Balanced Momtality Podcast, where we will talk about all things pelvic floor, your core, and optimizing your pregnancy, birth, and postpartum recovery, providing you with the knowledge and tools so that you can feel like the strong, playful, and happy mom that you and your family deserve. Now let's get you out of those pads and back to loving movement. Fill up your water, pop in those AirPods, roll out your mat, and let's connect. Before we start today's episode, just a quick disclaimer that anything mentioned in this podcast is not meant to treat or diagnose any medical conditions. If you have any questions or concerns about your healthcare needs, please seek the care of your medical provider. This is also a safe space where we will be talking about very sensitive but important topics, such as issues with peeing and pooping, relationships, and even sex. So if you have littles around, probably a good idea to pop those AirPods in. But otherwise, I hope you enjoy today's episode. Hey girl, today on the podcast, I have a special treat for you. So make sure you stay tuned and listen through the whole episode because I have an interview with an amazing and local sex therapist. Miss Cat Fite is on the show today, and I am so excited for you to hear our chat. We talk about so many different things. Our fields overlap so much and we could go on so many different tangents, and I have to say we did a pretty good job of reining it in, and I am excited because I know that she is going to be on the podcast in the future and we are going to be doing some awesome things together. But today, we are going to be chatting with Miss Cat, who is a licensed professional clinical counselor and a clinical supervisor in the state of New Mexico. She's an ASECT certified sex therapist who works with individuals, couples, and adults. She's trained in emotionally focused therapy, or EFT, eye movement desensitization and reprocessing, or EMDR, and the Gottman method. Her counseling approach involves developing a supportive and empathetic relationship, integrating evidence-based treatments and research, and working to empower and motivate positive change. So without further ado, here is Miss Cat. Cat, I'm so happy that you took the time to join me on the Balanced Momtality podcast. I'm so excited. I've been really looking forward to our chat. I know we had a little time to catch up and chat and get to know each other a little bit the other day, and it was so fun, and we just dove into so many different cool areas that our fields overlap and our interests overlap. So I know today's conversation is just going to be so fun, but I want to just start with just telling us your story and kind of what got you into the sex therapy world and what even is a sex therapist.
Yeah, well, thanks, Desiree, for having me. First of all, I'm like so excited, and maybe we'll tell the story of how we actually met at some point, which is so funny living in a small town, how our lives just like overlap, but then also, like you said, so much of our interests in both of our careers, yours as a pelvic floor physical therapist and mine as a sex therapist, overlap too. But so let me tell you a little bit about me. So I'm originally from Oklahoma. Northeast Oklahoma is home for me. All my family, except one sister and brother-in-law, live here in New Mexico. But born, raised, grew up there, was educated in Northeast Oklahoma, and was doing an internship in my counseling program at what used to be Cancer Treatment Centers of America, since has changed hands and names, some insurance issues or something like that as it goes in the medical world. But while I was working at the cancer treatment hospital, I was an intern for counseling and what they called mind-body medicine. So I worked on this interdisciplinary team with oncologists and with doctors and nurses, and I provided the mental health care. And there was a nurse on that team. Her background, she had a master's of science in nursing, and her name's Tracy. Shout out to Tracy. Her title at the hospital was intimate connections nurse. And I thought, what a fascinating title, especially to have in Tulsa, Oklahoma, where, at least in the culture of which I grew up in that environment, was people don't talk about sex, people don't talk about sexual health. And I think my sexual health education really centered around abstinence, which we know from research, abstinence-based education is not a great way to educate young people on sex, especially pleasure and choice and consent and boundaries. So when I came across Tracy, the intimate connections nurse, I thought, how countercultural? Who is this person? What does she do? And in her office, she had this bookshelf with vibrators and dilators and lubricant and wands and all of this fascinating sex stuff that I had no idea what it was. Well, come to find out, her title is a sex counselor. Sex counselors are certified medical professionals, so pelvic floor physical therapists, urologists, oncologists, nurses that have done a sexual health program. And so Tracy was in the middle of her sexual health program and introduced me to this world of sexual health, where she would tell me, Kat, a lot of the patients that we see together on this interdisciplinary team after their cancer treatment are unable to have sex the same way that they used to. And so her job as the sex counselor was to help them physically with their physical problems, whether it was educating on anatomy and positions and lubricant and pH balance, or, giving people ideas and suggestions to expand their view of what sex is. Sex isn't just penis, vagina penetration. Sex is so much more broad than that. And she helps people expand their view of that. And hearing that as an intern, I thought, that is what I want to do with my life. I want to help couples on the mental health side of how to expand their ideas about sex, how to create the best sex lives for themselves, and explore what does that even mean for each person.
That is so cool. I just love it. I especially love, having your background in a part of the country that, like you said, it already, like sexual health already is a taboo in our culture, which is kind of funny being, more of a modern culture, and having, just culturally it is a taboo and more of a topic that is sensitive, but especially in that part of the country you grew up in where there is more of that religious influence. And I just really love that you weren't like shy, like it didn't make you shy away from it. In fact, it made you more like, what is this about? Like, this is so cool. I need to know this. And then once you learned it was like, everybody needs to know, because I do find such a, and we could probably do a whole episode just on the, religious piece of how you do view sex and, all of that and how you approach that and how that impacts, not only your pleasure, but how you might experience it more as like a trauma and something that can end up causing pain and dysfunction down the road because of how you viewed how that was supposed to go down. And maybe it didn't go down how you grew up thinking it would be, morally or okay. And there's so many kind of gray, lines as you start to get into the sexual health world. And I just really admire your interest and your passion and everything involved in it. And I'm so thankful that you did dive into it and that you are here, even locally here in Los Alamos, which I think is so cool being a small town. I love that we have you here. And so I love that you're in, the sex health world. So, I would love you just to elaborate a little bit on what does a sex therapist help with? Obviously, sexual health issues, but what does that look like from your standpoint?
Mm-hmm. Yeah, definitely. And let me define sex therapist too. And maybe the best way to start with sex therapy is like what it's not.
Yes.
My introduction to sex therapy was this rom-com. Maybe you guys are familiar. It's a sequel to the Meet the Parents movie. It's called Meet the Fockers.
Yes, I
And it
love it.
stars it stars Ben Stiller. Ben Stiller plays Gaylord or Greg Fokker. And it's him and his fiance. They go meet his parents, played by Dustin Hoffman and Barbara Streisand. And Barbara Streisand plays a sex therapist in the movie Meet the Fockers. And in this scene, she has this like what looks like a group therapy setting for older adults, and they're like in sex positions and they're kind of stretching and she's sort of coaching them. That is not my experience of sex therapy and what a sex therapist does. I think it makes for good Hollywood.
Yeah.
um, and some overlaps, but let me read you the definition. ASECT is the American Association for Sex Educators, Counselors, and Therapists, and they define a sex therapist. So, sex therapists are all mental health professionals, licensed mental health professionals, and our training and experience is really the psychotherapy part, the mental, emotional, psychological health of sexual health when it comes to sexual health. So that can look like desire discrepancy, vaginismus, pain and anxiety, erectile dysfunction. So it's a really broad treatment. And most of us kind of specialize in a niche of that, are trained broadly and specialized. But yeah, we treat couples, individuals, clients, adults, even adolescents in, yeah, mental health concerns related to sexual health. So, yeah, what questions do you have about that?
Hearing you talk about, that whole spectrum of populations and all of the different types of conditions and everything, obviously a few really stand out to me, just especially seeing the populations I see and knowing, from my standpoint, I do think that one, pelvic floor therapy should be like a standard of care for every woman, and probably every human, right? We all have a pelvic floor, just like, mental therapy to some extent should probably be in everyone's like toolbox because we all need that support. But I'd be curious your thoughts on like, what especially out of some of those populations are maybe some that you would really advocate for being very proactive about some of those things. Like for me, I'm thinking specifically like the postpartum population who we know they're going through, like a hormonal roller coaster and body image issues usually combined in with that. And with that hormone roller coaster, we're seeing drops in libido and, all of those things where the postpartum depression is obviously something that we screen, but, thinking about even, pregnancy and just those body image changes in certain populations that really would benefit from seeing you regardless of if they are, noticing any issues. Is that something that you, advocate for, that you do just like screenings for? Is that like, any specific populations that you do think that would be really beneficial for other than, everybody?
More specific than everyone, and maybe where I'm a little biased. I think, yeah, mental health care is so beneficial and necessary, maybe for anyone. We can get something out of it, but especially sexual health, sex therapy. I think the key for do I need a sex therapist? Answering that question is, first of all, and I screen all of my new clients for this, pain with sex, pain with touch. Pain is a like red flag for me. If I have pain with penetration, inserting a tampon, touch, pain with anything sexually related, pain shouldn't be painful. And I think a lot of us are told, at least I was in my sexual health education, the first time that you ever have sex is going to be excruciatingly painful. And that's such a myth. In continued sex after a baby, sex during a pregnancy, sex, during menopause,
Menopause.
premenopause. Yeah, sex during, sex on long-term hormonal birth controls. We just kind of normalize this pain, and we shouldn't. Sex should not be painful under any circumstances. So that's a great time for me. That's always a big red flag. It's time for sexual health care.
Yeah.
If there's pain, Second, I would say fear and anxiety related to sex.
Mhm.
Fear and anxiety, especially related to pain with sex, dyspareunia, with penetration, fear, anxiety related to physical touch, to vulnerability, to any, that's a great time to see a sex therapist. With performance, how is my body going to function? I think you said this earlier, Desiree, what I think should happen, what that should be. And so sex therapy is a great option of working through those shoulds and fear and anxiety that come with the shoulds, what I should do, what I shouldn't, what's okay, what's not okay. Um, yeah, to
I love
process.
that. I love that because I think, and obviously I feel like I'm a little more savvy in the sense of screening for like, oh, that would be beneficial for obviously like a sex therapist. But in the general population, I'm sure there's some awareness of things like, if there is a sexual assault or rape experience or some of those more obviously traumatic things related to sex or intimacy that we might think, oh yeah, they definitely would need, some extra support. But it goes so much deeper into even just how you're culturally viewing that, experience in that situation. And pain, I love that you mentioned that because obviously that's one of my screens too. It's like, if there's pain, you need to see a therapist, whether it's, and obviously we're saying here a physical therapist, pelvic floor PT, and a mental health sexual therapist, because those are so interrelated. I know that I'm sure you have this conversation with your clients as well, how just interconnected that system obviously is, and how pain really is something that our nervous system and that physical tissue in our body are responding to. And we have to look at it from both ways. Like we have to approach it from the physical tissue side, and we have to approach it from the mental nervous system, the processing and all of that. And so I just love, bringing that holistic viewpoint in. And I love, for all the listeners out there hearing this today, like if you do have any of those symptoms, please seek support, because it is something that I feel like is I get, those conversations again of, oh yeah, I just, it was painful that first time. And I, was expecting that, or pain after a baby. Yeah, that was terrible, but we expected that. And it's just like, no, you don't need to have that experience. And so I just love that you're helping spread that message as well, because unfortunately, as I mentioned with you before previously in our chats, that I've had patients come back to me and tell them what other medical providers have told them, and even OBs and midwives and people that I feel like should know better, that, they're just telling people that, yeah, you're in your 40s, like sex is going to be uncomfortable now. Like, oh yeah, you had few babies, like
No.
that's, and it's like, oh, it kills me. And so I just love that you're helping spread that message. And so I did, like, and we could get into all the different ways that, pain and how the mental health side correlates and affects each other. But I'm curious personally, like, what the different types of therapy modalities that you use for this, like a lot of people think sex therapy or, not even just sex therapy, but mental health therapy in general. I think the most common one we hear and think of is talk therapy. So, I'm curious what those modalities that you most utilize are when it comes to this population, and specifically people that are experiencing dyspareunia and pain with intercourse and intimacy, and pelvic pain in general. Like, are you finding specific treatment modalities that are more effective, or is there a combination of things you're using, or what is that research and your clinical experience really showing for improving that population?
Mhm. Yeah, so kind of a few options, and also broad, like pain, dyspareunia is in my mind, I conceptualize that like an umbrella term that
Mhm.
holds a lot of different reasons for pain. And so working in the mental health side of pain, using things like, because when we experience pain, our brains protect us from that pain, sometimes by dissociating, by disconnecting from pain. So much of the work in the mental health field with different types of pain are just getting back into your body, noticing and connecting to your pelvic floor. And so maybe it's mindfulness in a session where we're just drawing awareness, where I'm drawing awareness to people's different body parts, and we're just noticing, and we're working on becoming familiar and becoming comfortable with noticing here, sitting here right now, to your vulva, noticing your sit bones pressing against your seat, noticing any pain or discomfort in your body. And so a lot is just noticing, or what some would call mindfulness, and then working directly with what's disconnecting. Is it trauma? Is this trauma related? Is this anxiety? Is there past sexual assault? Do things that we need to work through? And if that's the case, I'm an EMDR trained provider. So EMDR is an acronym for eye movement, desensitization, and reprocessing. And it's one of the most highly effective evidence-based treatments for trauma, such as sexual assault or just anxiety, fear. And that is an 8-part process, but can be a really quick and really efficient way to work through somatic body held symptoms of fear, anxiety, trauma, where pain originates. So working, like I was saying, on a multidisciplinary team with a pelvic floor physical therapist or a urologist or an oncologist or primary care or a psychiatrist, we can all, from our different trainings and angles, I'm like making the circle with my arm like a wraparound. If we can do these wraparound services for pain, I see my part as working with the mental emotional health, and that's often EMDR for me as a sex therapist. Part of my training is that. The other part I love working with is I'm a emotionally focused therapist, and EFT, emotion focused therapy, is very much like it sounds, is very emotion focused. It's warm and it's genuine and it's empathetic, and it's creating an alliance and a strong therapeutic relationship where we can talk about what are your emotions, what's happening internally right now as we go there, and processing and giving space for those emotions. Some therapists, and sometimes this is also really helpful, is cognitive behavioral therapy. So kind of a different approach than EFT or even EMDR. Cognitive behavioral therapy, or CBT, is working with the thoughts. CBT asserts that we have thoughts first, and then we have emotions, and then we have behaviors. And so if we're working with those cognitions first, what do I think about my vulva? What do I think about this pain? What do I think about sex or penetration or my body image? We're working with that first, and we're reframing those negative beliefs through psychoeducation, through saying, actually, your clitoris is made for pleasure. And your clitoris extends all the way from your pubic mound all the way down behind the anus. So here's this space just made for pleasure, all pleasure. And so if I can use a little bit of cognitive work, CBT, and a little bit of psychoeducation, then we can, and I keep making this movement like we're shifting. If we can go from A to B, and A is rigid, and it's negative, and it's contained beliefs that culture or society or whatever has put on you, and we can move to B, to a more holistic and realistic and expanded view of sexuality, then so much work is done there, sex therapy wise, mental, emotional, psychological.
I love that. So it sounds like, you're doing a little bit of everything in terms of addressing that processing of the body and releasing and helping the body kind of process through held trauma, looking at the emotional side and the cognitive thought side, because it is, to me, from, just my physical and how I do feel like, even though I'm a physical therapist, I do so much of that, just like processing and mental talk therapy, more like, just like helping people process through a lot of this stuff. And so I just love hearing that your approach really is kind of a little bit of everything, because it is so crucial to, again, kind of get it from all angles. And so I just love that. And I expect, I'm so interested in the eye processing one. I want to learn more about that, because there's even, some therapy, physical therapy processes where we really work with the fascial system, through eye movements and tongue movements and things like that, and just working kind of more craniosacrally. And it's still physically with physical tissue, but it's been really interesting because my experience doing that with patients in the past, it's kind of one of those types of therapies for the physical therapy world that can kind of be thought of as like, kind of woo woo. Cause it's like, oh, why are you doing eye movements for this person who just had hip replacement surgery or something, and we would be working with these people's eyes and their tongues. And I was learning from a mentor at the time in a skilled nursing facility, and she was teaching me like, some of this work, and she wrote a book on it and everything. And it's super cool. And it was so fascinating to me because it felt like it didn't really, connect. But then I would see these people come from like 10 out of 10 pain to all of a sudden like 2 out of 10, and they could get up and move around just from like messing with their eyes and their tongue, and it's so cool. I could totally see how, just using eye movements and stuff could help unlock random stuff throughout the body. And it is really interesting being a very hands-on manual therapist. I've mentioned this to you when we chatted too, just how I do physically feel that like tension and, release work. But there's so many ways that we can do that and help kind of working through that. And so it's cool to just hear another way that we can kind of help release trauma and process through everything. I would love to know, you mentioned a few things already, but for like, because I do want to give my listeners something kind of practical or some tools or tips that you have, even if it is like some eye movements or some breath exercises or mental affirmations, or what are kind of, especially for that woman who's maybe sex isn't like so bad that they're not doing it anymore. And maybe it is, but like what is for that woman who is maybe, they're wanting to find that pleasure again, and they're wanting to have a pain-free experience. What are some practices that you would advise them practicing, whether it was like daily or maybe even right before intercourse or during or after? Obviously, I know you probably have tons, so just one little snippet, I would be so grateful.
Mm-hmm. Yeah, gosh, that's so tricky. And I only hesitate because there's so many different reasons we all hold in us why not to have sex, why
Yeah.
it's not a good time, or my body's in pain. Or so if I'm speaking directly, I guess, to the woman who has pain and who knows my partner is going to want to have sex tonight, I would say get a multidisciplinary team in your corner and get to the bottom of why is there pain. And let me just normalize and say it is so common. Dyspareunia is the most common form of sexual dysfunction in women under 40, in women premenopausal. And so if you have that, know A, that you're normal, and B, that sex should not be painful. When we are pushing through, and we're pushing through like, I know my partner wants to have sex tonight, and whatever I tell myself I should, my partner wants me to have sex or engage in this sexual intimacy that they want that I don't necessarily want. Research is very clear. Relationships end up in what they call this death spiral, the sexual relation. It sounds morbid because it is morbid. This sexual relationship death spiral. And so if you find yourself a woman with sexual pain in sexual encounters that are painful for you and you're pushing through, stop doing that. Don't do that anymore. Find a pelvic floor PT, find a sex therapist to help you with that pain, because the more that we push through painful experiences, the more of an aversion or fear, of course, the more painful things that we do that we don't like doing, the more we're going to be adverse to doing that. Stop doing that and get some support to have the sex that you want to have. And I guess what I will leave all of us with, no matter where you're at sexually, you have no sexual pain, or you experience sexual pain all of the time. Maybe wearing jeans or pants is uncomfortable. It's not even sexual. Maybe you just experience pain. Figure out, what is sex worth wanting for you? Define that. If I could look ahead at my life 5 months from now and say, I'm having sex that's worth wanting for me, what is that sex? Is it penetrative sex, non-penetrative sex? Is it non-sexual? Is it non-sexual physical touch? What is that? And start thinking in terms of, what is sex worth wanting for you? Because I think we internalize and we all get these messages of what is sex that I should be having, or what is the sex that's good? And if you don't know what that is, if you hear my words and you're like, gosh, Kat, I don't know what sex worth wanting is for me, I want to recommend a resource, if that's okay with you, Desiree,
Yeah,
if I can do that.
please.
There in Colorado Springs, there is a group of researchers who have created this website, omgyes.com. Omgyes.com is like, oh my goodness, yes.com. If you go there, there are 3 seasons available for sale. And each of these seasons, the first one is external pleasure. So it's all clitoral stimulation, sexual external stimulation. And then the second one is all penetrative stimulation, all kinds of penetrative sex, partnered or with a sex toy. And then the third season is all research-based, evidence-based pleasure with toys, even a little bit of anal stimulation in play, because we know the clitoris extends all the way to the anus. And so if you like butt stuff, it's because it's pleasurable and sensational. And so, you know what? This OMGS website, I think, was maybe one of the greatest resources I discovered in my sex therapy program of just expanding what is sex worth wanting. And I think was the first time I had conceptualized for myself, yeah, what is sex that I want? You know, what is good sex for me? And so whether you're experiencing pain or not, OMGS is a great resource of many resources to define maybe what does that look like for me.
I love that. I've heard of this resource and I haven't checked it out much myself other than kind of browsing their website, but I
Mhm.
think it looks so cool. And I think it is something that I wish like I, knew about a long time ago because from what it seems like that, just reading through their website, which we will link in the show notes of today's show, but I, even just read some words of stuff that I was like, what's that? Like there's so many different things that we're unaware of. And I love that you mentioned that and use that as like your advice for, kind of like a rule of thumb. Like obviously don't like stop pushing through stuff that is uncomfortable because that is going to be how we're just perpetuating that feedback loop and creating that sense of trauma and kind of ignoring our own body's boundaries. And that's kind of where I feel like, trauma really is created when we're just, putting up that, especially when it to me, I've seen it look a lot like dissociating, if patients are, and that can look like such a spectrum too, right? Because I know there's even, that condition of dissociation, but just thinking about something else, like when we're going into those experiences or working with the therapist hands-on, or if you're doing your own wand work or dilator work, and if you're disconnecting. And I always tell my patients too, like it's not about like, oh, let's get as big of a stretch as we can with the dilator and just kind of disconnect and think about tomorrow. And oh, she said, if I just show up here, this is going to help my tissues. Like that's not really going to help you. And in fact, it could actually make things worse if you're really just, placing and trying to ignore the pain, because we are looking for some level, to some extent when we're working with tissues, especially things like vaginismus, where that vaginal canal is really closed down and we're physically trying to stretch the space. We are looking for a level of stretch and trying to open things up. But I think it's such a slippery slope because people can kind of get stuck, they'll get really frustrated that they haven't progressed through their dilators as quickly, or maybe they were progressing quick and then they are having a hard time, getting into that next level. And I find it's just because they're kind of going too intense and too aggressive and they're not in their body really present with, does this even feel good? Like the dilator needs to feel like it is, like you can relax around it and breathe around it and your tissues can release around it. And so just being, again, kind of how you said that first step at the very beginning of this chat about awareness and just connecting. Like I'm always a big advocate for that being that first step, because you can't heal from pain if you don't know what's even hurting, right? Like what's actually hurting. Maybe some of the areas actually feel good to be touched. Maybe, just learning your body and really getting that sense for what you like, because I do think that that is, again, like a space for where people struggle, is they're trying to meet their husband's goals or society's goals, or maybe their libido is so low that they just have no drive to do it, and maybe they did just have a baby, so there's some pain there. And so there are, you alluded to a few. There's so many things that can cause, pelvic pain and dyspareunia. And I am doing my series through the podcast this month talking about this. So hopefully people are listening in and they've heard the last couple weeks episodes where I did go into a lot of the different factors that can cause dyspareunia and a lot of some of the physical tools and other resources out there for this. But I do just want to advocate, and Kat, you can add to this too, about just really rewriting your story for what that sex life should look like for you. And again, like, what is that best case scenario? And it's not that we're going to force ourselves or our body or anything through something that we're feeling and, we're resisting. And it's hard, right? Because with something like this, there's resistance, and it could be pain. Like, the resistance could be a physical pain, or it could be, right, like the shame because of how we were brought up or something like that. And so it is a tricky field, and I'd be curious even to hear how you kind of approach this with, especially, I feel like, the shame piece, because working through physical tissue is one thing, right? Like, there's like some discomfort, and I'm always telling them, there's going to be a little discomfort, but it needs to be tolerable enough that you can relax into it. You can still be in your body. You're visualizing where that discomfort is. We're breathing into it, all of that. But even mentally, right? Like, this is a space where even if those tissues could tolerate a stretch, if that person is like cringing up and you can see that they want nothing to do with using a dilator or a wand or anything like that, and it's more of that mental resistance, I'm curious, because it's like some things you want to push through and some things you want to honor, your values and your morals and all of that. So at least, like, my approach has been with my patients just to ask why. Like, I'm like, don't ever force yourself to do anything that you don't feel comfortable with, but I do want you to ask why. Like, is it because you're afraid of the pain? Is it because you've never looked at your vagina before and you've never touched it and it's simply just getting to know your body? Or is it that you do have some of these histories and, how you culturally were brought up, where you do feel like, if I take this step, that goes against like what I believe? And so how like would you kind of go about addressing some of that? And that's probably like, well, come see me. Like, you need to see a sex therapist because you've got a lot going on.
Uh-huh. Yeah, well, no, I think that's a great question, because we all face that, right? Like, what's the goals? And just when you were talking, I so appreciated you naming trauma, because what happens, well, let me just give you my best working definition of trauma. In all of my years as a trauma-informed therapist, I think my favorite definition of trauma is any stressor we experience in our life that we're not equipped to deal with at the time that it happens to us. Any stressor we're not equipped to deal with at the time that it happens. And when we face those stressors or those traumas that we can't manage or adapt to, that is stored in the body, right? And we keep talking about it as a tension or as a clenching or as a pain. And so I think what we do, how maybe our modalities, yours, Desiree, and mine, is to help people relax and release and let go of their tension in their body. And I think where we go with that and the goals that we set are all based on good assessments in the beginning of therapy. Or in the beginning of pelvic floor physical therapy or mental health sex therapy, it's like, where does each individual person want to go? Maybe some people do have the goals, like you were saying, I want to work through this shame. I have this shame that keeps me inhibited in a way that I don't want to be inhibited, or negative about my own sexual experiences that I don't want to be negative about. Or maybe people say, I want to try anal penetration. I want to try multiple partner sex. I want to try this thing that feels out of reach to me because of it. So the client, really gets to set the goal of whatever they want in therapy. And I think that's where a good assessment comes in the beginning, asking a lot of open-ended questions and letting each person fill in the space of what they want their outcomes to look like. I think pelvic floor PT and sex therapy can look like a lot of different things, a lot of different outcomes. Yeah.
Totally.
Does that answer your
It does. And I know I unloaded like 5 questions at once on you, so I apologize. But I love, I love that answer. And you're so right about trauma, right? Like trauma is something I think, um, and whether it was like, again, an obvious trauma, like an assault, or it was, maybe some childhood stuff that you have no idea you were experiencing, and maybe it even had nothing to do with the pelvic floor space itself. I've definitely seen such a connection with that pelvic floor space, just holding so many different stories and experiences. So we can't forget and ignore any trauma. And I think that it's really interesting, again, like how I've seen it physically kind of just release and come out of the body. It's so crazy to see because you can just feel that tissue release and relax, and their pain goes away. And obviously it's a process and kind of reworking how your body, because also muscle holds memory and the body holds memory. So like it's a lifelong journey processing through all of this, right? And that's why it's good to have people like us in your toolbox for most of just throughout your life, because things come up. But I was curious, like for things like libido. I have a lot of patients who ask about libido. And I know, physical therapy, pelvic floor especially, we work on a lot of things to help increase that pleasure and sensitivity to the clitoris and mobility to the clitoral hood, and making sure that blood flow is getting there and we're getting amazing orgasms and all of that great stuff. But I have, women, especially if they're going through like menopause, or obviously pain can do this too, just in general, but any of those hormone dives where we just see like, or people that are like struggling with libido and they're like, I've gotten things checked and everything like seems okay. Like, what would be your advice for some things that people can kind of start either looking at to start exploring to see if that's affecting their libido, or some tools and tips that you've seen help improve that, whether it's cognitive stuff or anything in your realm?
Mm-hmm. Yeah, I love this question because I love exploring like pleasure in it's like the goodness in the fun and the expanding of sexual health. So I would say, first of all, as a sex therapist, kind of what I'm looking for is red flags when someone is saying my libido is lower, or I'm not having as much sex as I want to be having. Then I'm always questioning things like SSRIs, selective serotonin reuptake inhibitors, are known to have 2 effects against libido. One against libido and then inability to orgasm. So you do the same desire, the sexual response cycle, the desire, the excitement, the plateau, but then there's just no orgasm. It's like an inability to orgasm when you get to that part often on SSRIs. And then just a lower libido, a lower spontaneous desire that just pops up like, oh, I have these sexy feelings or this sensation. And so I'm always looking for SSRIs and educating and suggesting maybe a visit to the psychiatrist or primary care, whoever's overseeing that medication, to see if there can maybe be a switch, or figuring out the timeline. When did you notice this lower libido? When did you start taking this SSRI? Now, whether people are on an SSRI and they want to stay, or they're not on an SSRI, the next route, the next direction I go is our greatest sex organ. And our greatest sex organ is our mind and our fantasies and our desire. And so we start working with, what is sex worth wanting? What's good sex? How do we start fantasies? And I know some people, scheduling sex works for them. And I hear these fantastic stories of like, I bought new lingerie, or I bought this new sex toy, I bought this new flavored lube, or I bought these wax candles, or I bought these, whatever things to look forward to kind of start motivating, start looking forward to and anticipating a sexual experience. Scheduled sex often works for, if it's a heterosexual couple partnered, it often works for the female partner that's saying, great, it's on my calendar, I'm thinking about it, I'm anticipating it, but it often will create anxiety for the male partner in the heterosexual couple. So when I've seen this work, I've seen it work where the female partner keeps it on her calendar and it's private and it's a surprise. So it's not creating anxiety in the male partner, like having to perform. That's a whole other podcast of performance anxiety and what we do with that. But then the next thing is something like taking a class, for instance. Self Serve is an ethical sex toy shop in Albuquerque, New
Love
Mexico.
that.
They have, whether you live in Albuquerque or even in New Mexico or not, Self Serve has virtual classes, all things from flirting to making out to um, rope tying to bondage to sex toys, all kinds of stuff. And then also, I would back to the OMGS website. OMGS is all about pleasure. And if we can get what Dr. Emily Nagowski wrote a book called Come As You Are. And if we can do what she says in that book, she's a sex educator, sex therapist. And Emily says, if we can just put ourselves in a sexy context, and she uses this example of put my naked body next to my partner's naked body, and we can just see what happens. If we can put ourselves in sexy context, if we can get a babysitter, if we can get time alone, if we can schedule sex, if we can have novelty. Us humans love novelty. We love new things, new candles, new toys, so if we can bring in new things and fun and excitement, that I think is some of the greatest things to help with libido.
I love all of that. I especially love, just the again, like make it pleasurable, like make it fun. And I think it's hilarious. I can totally see how scheduling would make it, just anxiety provoking for guys. And it's hard, right? Because like I do see a lot of women and are especially moms. So a lot of parents and have young kids, and it makes it so hard because you do kind of have to schedule things in. And it does get tricky because we're not only dealing with like the hormone dive and all of that, but now you're having a lack of sleep. So that's going to affect your energy and your libido and how you're connecting. You also probably have, at least we did, a baby in our bed for like a long time or in your room, And so it's like you have to get creative, and it can feel like, do we just have to schedule this now? And all the spontaneity is gone. And so it gets tricky. I think that I like that idea of like the woman kind of planning it, but it's a surprise for the man, It's like we can still create that sense of like, okay, because I do feel like, especially for women, like we need that ramp up time. Like foreplay is so important, even if that's, again, like mentally in your own head, getting your mind and your body on the same page so that your tissues and everything are just got the blood flow, got the hormones and the endorphins already pumping, and it makes it so that everything's going to feel better because it's able to stretch and accept any amount of change of pressure or stretch or penetration or friction and movement like that we know can cause pain if there's dry tissue or fragile tissue and we're lacking some of that natural body lubrication, but also just to allow you to orgasm. You're not going to be able to if you're not in your body and really connecting. So I think that having some of that warm up time for females really helps just set their body. And I even have I encourage women to do some of the breath work a little bit right before, if they have the luxury of kind of knowing like, oh, this is going to be coming up soon. So let's actually do a little bit of the deep breathing and maybe even some wand work and release work, maybe even a little dilator work just to get everything ready. And yeah, we all hope that, we have the fun, spontaneous moments that our body's ready for and it's not going to hurt. But I love those tips, just kind of getting in your own body and also getting curious and getting fun and playful with it because it's supposed to be, and it shouldn't have to feel like it's this, to do on the whiteboard. We want to enjoy it and explore it. And so I just love that. And I love chatting with you, Kat. We could obviously talk on so many tangents of things we talked about today. So I'm already excited for some of the other episodes I will be having you on for. So I really appreciate it. And I just wanted you to wrap up with, I know that you are local in Los Alamos, New Mexico. So you are providing in-person services here in the local area, but how else can you help? Are you, helping people? How can people find you? Kind of let us know for those listeners who were just like, oh, I love Kat, I want to reach out to her, or I have some questions for her. What's the best way for people to go about that?
Yeah, well, I would love that. So I have a website, and that's kind of like the hub. So my website is Hilltop Counseling, NM, like New Mexico.com. So hilltopcounselingnm.com. And it talks about me, the services I offer. There's a cute picture of my therapy dog. He comes to the office with me most days. My email and ways to get a hold of me. I'm also on Instagram and Facebook. You can find my Hilltop Counseling NM, like New Mexico. So Hilltop Counseling NM. And so follow me there. This is where I post a lot of sex therapy content. I'm also a couples therapist, couples therapy content, trauma, anxiety content. So follow, link, email, message. I would love to hear from you.
I love it. And I will be linking all of Kat's contact information, her website, her socials, all of that in the show notes below, so that you can find her. Definitely reach out. She is an awesome human. I'm so thankful that she was on our show today. Thank you so much, Kat. And I'm so looking forward to our next chat.
Yeah, thanks for having me, Desiree. I'm honored. Thank you.
Well, that's it for today's episode. I hope you enjoyed it as much as I did, and I want to thank you so much for taking the time out of your busy day. I know you've got so many other important things going on, but I hope it was helpful and you leave here with some tools to help you in your healing journey. And I just want to ask you, if you have found this helpful, to please leave a review on iTunes. Scroll down to the bottom of my podcast page and leave that 5-star review so it can help other women see this information. And also, if you want to be a part of my community of amazing women trying to balance all the things, great tips and insight and sharing stories and just motivating each other along the way, feel free to join my Facebook group, The Balanced Momtality Wellness and Support. I hope to see you here next time on the Balanced Momtality Podcast.